According to the Uganda Cancer Institute, 10% of the cancer victims in Uganda are children.
These are children up to the age of 18.
And according to the 2018 Global Can Report on Cancer in Uganda, about 3,000 children below the age of 18 are expected to develop cancer every year. However, only 30% of these children will seek medical attention.
We have a huge challenge to increase the number of children with cancer in Uganda that are actually getting diagnosed and making their way to specialized centers like the Uganda Cancer Institute for treatment.
Every year, the Uganda Cancer Institute receives 600 new children under the age of 18 with cancer. 100 of these are adolescents between the age of 15 and 18.
The government of Uganda has established such a center at the Uganda Cancer Institute, and this is the only comprehensive childhood cancer treatment center in this country.
Dr. Joyce Balagadde Kambugu, a pediatrician and consultant at the Uganda Cancer Institute, explains the most common cancers among the children received at the Cancer Institute.
Cancer of the blood, that is called leukemia. Cancer of the lymph nodes, that is called lymphoma from the lymphatic system. Cancer of the kidney, which is called Wilms tumor, and then cancer of the muscle.
She further highlights that cancer in children mimics a lot of child illnesses and therefore makes it a challenge for parents and health workers to suspect. However, cancer among children presents itself in the form of a swelling, usually painless, a white pupil instead of black in the eye, unexplained weight loss, and non-resolving symptoms.
You've treated for malaria, you've treated for resistant malaria, typhoid. Fever is one of the most common presentations of cancer. Headaches, for example, headaches that don't resolve.
From the global perspective, 8 out of 10 children are expected to get cured of cancer if diagnosed and treated early, while in low and middle-income countries, only 3 out of 10 are expected to cure. However, for Uganda in particular, 5 out of 10 are expected to cure.
Even though we are not at 8 out of 10, we have one of the highest survival rates in Africa, in sub-Saharan Africa.
The challenges limiting the expected number of cures include no diagnosis, misdiagnosis, treatment abandonment, suboptimal treatment, surgery struggles for PIDs, and lack of drugs.
Children with cancer require very specific surgery from specialized surgeons for children called pediatric surgeons. Right now in Uganda, there are very few, there are about 6.
Government has improved the state of the equipment at the Uganda Cancer Institute to ensure early diagnosis, but also the decentralization of services.
We are not limited to the Northern Uganda Cancer Center alone, Regional Cancer Center. In Mbarara, we already have the land, but at the moment we are already working within the Mbarara Regional Referral Hospital. In the Eastern region, we are going to set up a regional cancer center in Mbale. In Arua, for West Nile, we are going to set up a regional cancer center.
Much as the government has done the technical part, more is still needed in terms of psychosocial support in the fight against cancer.
How are they feeding? Where are they sleeping? Do they have transport? Do they have all those things? How are you supporting them to remain in school? Because that is their closest desire when you speak to them.
Patrick Senyondo, NTV.